Now that the governor has laid out the metrics that need to be met before a county can apply to reopen, the pressure is on. Rural counties with smaller populations likely applied to take the first step today and will be granted permission next Friday. But the biggest counties, not even close to applying. Here's Dr. Jennifer Vines, the health officer for Multnomah County.
Minimum 3 weeks, probably more like a minimum of 4 weeks, realistically. And we don't know what's going to happen between now and then. Again, a month in this pandemic, things can change dramatically.
Why does it take so long? Well, turns out there's a bunch of work to do, according to Dr. Vines. The governor set out 7 metrics each county must hit before even applying. The first 2 involve a falling in the numbers of people with COVID-19. The metrics are fewer people with flu-like symptoms showing up at the emergency room in that area, and a 14-day decline in hospital admissions for folks with COVID-19. But even that part is confusing.
I think we'll be looking for a bit more detail from the state on what constitutes a decline. And if there are some bumps over 14 days, does that count? Does the clock restart anytime there's a plateau? So I think there are a lot of details yet to be worked out.
Then there is testing. The region must have 30 tests available per 100,000 people.
Testing supplies that you need in a clinic, testing supplies that you need in a lab, and then people to do the test, plus personal protective equipment for those people. We have struggled to bring those things together in a way that makes testing readily available to the community.
The governor's plan also requires frequent testing of workers in meatpacking plants and agriculture producing operations. But it doesn't seem to say whether the government or the company is responsible for the testing or the costs. Then there are the tracers, the people who call known positive cases and get the names of everyone they were in contact with. Under the governor's plan, Multnomah County will need about 120, many more than we have now.
The rest of the plans, though, to scale up further are for now on paper. And so this is going to be a big lift. We also need to make sure that these contact tracers speak different languages, are from different communities. Excuse me, again, because trust is really a key component of the contact tracing.
And then there's the 20% hospital surge capacity. That's easy to meet right now because the hospitals were emptied out to make room for the pandemic. But what if they fill up again? And then there's the PPE. Again, the hospitals are fine for now, but what if there's another problem with the supply chain? And counties need to have places to go where they can put COVID-19 patients who cannot quarantine themselves at home. Multnomah County does have several ideas on that, but it's one more series of details that need to be worked out, and it's why health leaders say it could take a month before Oregon's most populated county is ready to even apply for Phase 1 reopening. I also checked in with Clackamas County. They say it'll be at least 2 weeks before they can apply. Washington County says more like 3 weeks. They still need to hire 100 contact tracers. In Northeast Portland, Pat Doris, KGW News.